Diabetes mellitus is one of the major health challenges that the world is facing today. A deficiency of the hormone insulin from the pancreas or the inability of the body cells to utilize the insulin leads to a state where there is excess accumulation of sugar, that is glucose, in the bloodstream. This excess accumulation of glucose or sugar in the bloodstream leads to the multiple symptoms that patients of diabetes feel and suffer. Easy fatigability, generalized weakness, tiredness, the need to frequently urinate leading to increased thirst, polyphagia, the need to eat more, yet having excessive weight loss. These are all common complaints from a diabetic. The regular practice of yoga helps us to utilize the excess blood glucose. It helps resensitize all the cells of the body to the insulin signal. This type of reworking of the neuroendocrine mechanism is a specialty that is found in yoga. In this presentation, we shall be learning how to perform the Surya Namaskar, the sun salutation, that is an excellent practice for the entire endocrine system. We shall be learning forward bending postures where there is a compression of the abdomen. These forward bending postures may be from the standing, from the sitting, or from the lying down. We shall be learning twisting postures such as the TRIKONA Asana in the standing. We shall be learning the sitting twist like the Ardha Matsyentra and Vakrasana, and the lying down twist such as the Jatara Parivritta. We shall be also learning topsy-turvy postures such as Sarvangasana, the Viparita Karani, and the Janu Sirasa Sarvangasana. The topsy-turvy postures help us to restore normalcy, restore the homeostatic level where the neuroendocrine system can function to its perfection. When these practices are performed regularly, there is a tremendous improvement in the condition of the physical, mental, and emotional states in the patients of diabetes. I have given you many practices in this presentation. It is not necessary or possible to do all of them every day. I suggest that you meet and consult a qualified yoga teacher or a yoga therapist and use those practices that are most beneficial to you. Different schedules can be made. A schedule can be made where you use the Surya Namaskar with a few of the twisting postures. A schedule can be made based mainly on pranayama, such as the Pranava Pranayama using the A, U and sound. Using the Chandra NAADI Pranayama, that is a left dominant flow of the air. This helps to reduce the blood pressure and the blood sugar. Depending on the age, depending on the gender and the physical condition of the patient, these different schedules can be made and practiced. I am giving these practices for your understanding, for your knowledge, and when you practice them, please take the guidance of a qualified yoga teacher or yoga therapist. I wish you all the best in this journey from the state of disease to that wonderful state of optimum health. Namaskar.
ऋषिकेश सूर्य नमस्कार। Rishikesh Surya Namaskar, the yogic sun salutation, is a series of 12 physical postures. These alternating backward and forward bending postures flex and stretch the spinal column through their maximum range, giving a profound stretch to the whole body. The basic breathing principle is to inhale during upward and backward bending postures and exhale during forward bending postures. One full round consists of the 12 poses done twice in sequence. Practice 3 to 9 rounds of the Surya Namaskar daily for maximum benefit. When the same movements are done little quickly, the gain is more physical, and when they are done slowly with breath awareness, the gain is more mental and spiritual. Stand erect with your feet close together. Perform Namaskar Mudra by joining your palms together in front of your chest. Breathe in and stretch your arms over your head into the Anjali Mudra and then arch your back. Feel the healthy stretch in your whole body. Breathe out and bend forward while bringing your hands back to the chest in Namaskar Mudra. Perform the Padahastasana by bringing your head to your knees while keeping your hands on either side of your feet. Breathe in and extend your right leg back until it is as straight as possible and you are balanced on your toes and hands. Your left leg should be bent with the sole flat on the ground. Lift your head and bend back and open up your chest. This is the Ashwa Sanchalanasana, the equestrian posture. While breathing out, bring your left leg back towards the right and keep the feet just a foot apart with your heels flat to the ground. Simultaneously, raise your buttocks and lower your head between your arms so that your body forms a triangle with the ground. This is the Meru Asana or the mountain posture. While maintaining the posture, take a deep inhalation. While breathing out, drop both knees to the ground and slowly slide the body down at an angle and bring your chest and chin to the ground. 8 parts of your body, namely your toes, knees, chest, hands, and chin should touch the ground while the buttocks are kept up. Breathe in and come into Bhujangasana, the cobra posture. Focus your awareness at the base of your spine and feel a healthy stretch in your back and neck. Exhale and come back to the Meru Asana, the mountain posture. This strengthens the arms and legs as well as the spinal column. Inhale and bring your right leg forward in between your hands while keeping your left leg in its original position to perform the Ashwa Sanchalanasana. Breathe out and bring your left foot forward to come into the Padahastasana. Breathe in and come up and perform the Anjali Mudra and bend backwards. Breathe out and come back to the standing while bringing your hands back to the chest in Namaskar Mudra. To perform the Rishikesh Surya Namaskar on the opposite side, perform the practice again with a slight modification. To complete the other half, the same movements are repeated except that the left leg is brought back while performing the Ashwa Sanchalana the first time. The other postures such as Meru Asana, Ashtanga Bhumi Sparsha, and Bhujangasana are done in the same manner. When coming back to the Ashwa Sanchalana, the left foot is brought forward and then the Padahasta is performed by joining the right foot to the left. Breathe in and come up and perform the Anjali Mudra and bend backwards. Breathe out and come back to the standing while bringing your hands back to the chest in Namaskar Mudra. And finally relaxing in the Samasthiti with deep breathing. HASTHA KONA KRIYA. Stand in Samasthiti Asana with your arms by your sides. Slowly breathe in and lift your right arm over your head. Try to extend the arm over your head towards the left as far as possible without bending it. This gives a good stretch to the entire right side of the body. Slowly start to breathe out and lower your arms back to the side. Perform the practice on the opposite side by lifting your left arm over your head while breathing in. Extend it as far towards the right as possible without bending it. Feel the excellent stretch on the entire left side of your body. Lower your arm back to your side while breathing out. Repeat the practice a few more times for maximum benefit. HASTHA KONA KRIYA helps to stretch the musculature of the arms, shoulders, and paraspinal area in a way not done in our day-to-day lives. This helps trigger the relaxation response in these tissues that are normally tense due to disuse, misuse, and abuse. A sense of profound relaxation is obtained after the sincere and regular practice of this activity, that is also known as the Ardhakati Chakrasana, as it provides a half stretch to the hip region. Padahastasana. Stand in Samasthiti Asana and slowly raise your arms up as you breathe in. Maintain the stretch and bend forward, bringing your hands to the ground as you breathe out. Place your palms on either side of your feet. Breathe in and look up, stretching your neck. Breathe out and bring your forehead to your knees. This posture gives a good stretch to the entire spine and provides an improved flow of blood to the upper part of the body by virtue of being one of the poses where the head is below the heart. When ready, breathe in and come up to the standing pose by slowly raising your arms and torso in a steady manner. Bring your hands back to your sides and relax in the Samasthiti Asana. Trikonasana. Stand in Samasthiti Asana. Place your feet 2 to 3 feet apart and stretch the arms to the sides so that they are pulling the chest in opposite directions. Turn to the right side and slowly bring the right hand down to the right foot and place the palm of the right hand on the ground in front of the right foot. Look up at the middle finger of the left hand. Let the entire torso get a good twist and stretch. Hold the position for 30 seconds while performing deep breathing. Release and come back up to the open arm position. And then do the opposite side by placing your left hand down in front of the left foot. the position for 30 seconds while performing deep breathing. When ready, slowly come back up to the Samastiti Asana and relax with a few rounds of deep breathing. Padottanasana. Take a firm Samastiti Asana with your weight balanced on your feet. Spread your feet apart and stand in a steady manner. Lift your arms up to the middle, stretch them to the sides as pulling your chest opposite thighs. Breathe in and stretch your arms upward, keeping them parallel to each other above your head. Breathe out and slowly bring your hands until touching the ground. Round in between the legs, your hands placed palm down on the ground on either side of your head. The position to slowly lift the hands away. Come back to stand position in a slow, steady manner. Relax. Trikonasana. On the ground, both your legs out in front. Slowly bend your knees and gently down your heels so as to lift your entire body on heels and knees. Try to keep the heels of both feet as close. Padottanasana. Take a firm Samastiti Asana with your weight balanced on your feet. Spread your feet apart and stand in a steady manner. Lift your arms up to the middle, stretch them to the sides as pulling your chest opposite thighs. Breathe in and stretch your arms upward, keeping them parallel to each other above your head. Breathe out and slowly bring your hands until touching the ground. Round in between the legs, your hands placed palm down on the ground on either side of your head. The position to slowly lift the hands away. Come back to stand position in a slow, steady manner. Relax. Trikonasana. On the ground, both your legs out in front. Slowly bend your knees and gently down your heels so as to lift your entire body on heels and knees. Try to keep the heels of both feet as close together as possible. Sit straight with your spine and both arms on the respective thighs. Perform a few rounds of deep and controlled breathing while in the bottom. Vajrasana Thunderbolt is an liberating posture that helps us to generate and conserve the vital energies for health and well-being. Posture may be done after a meal that helps to improve digestive process greatly. When ready, slowly come back onto knees and brisk sitting on the ground with stretch out in front. Repeat a few times and then thump your thighs to relieve any acute tension. Sapnasana. Sit in Vajrasana and bring your forward to place forearm to the ground, palms face down, and your elbows touch knees. And back as possible. It is possible for 3 to 6 rounds. Feel the positive tension that develops against your diaphragm as you breathe deeply in this position. After a few rounds of deep breathing, release your head and let it dangle forward for some relaxation. Repeat this incomplete rabbit posture with breath awareness twice more to complete a set of 3 rounds at each sitting. After performing the practice as required, release the pose and come back to Vajrasana. Perform some head rolling and head turning to release any strain that may have accumulated in your neck during the practice. Purna Shashasana. From Vajrasana, bring your hands forward and place your palms on the ground directly in front of your knees. Your wrists and knees should be as close as possible. Keep your arms straight and lift your head and look up as far back as possible. Perform 3 to 6 rounds of deep and controlled breathing into the mid-chest while holding this final position. After performing the required rounds of breathing, let your head relax onto your chest for a few seconds before repeating the practice 2 more times at each sitting. After performing 3 rounds of practice, release the position and come back up to the Vajrasana. Place your palms back on your thighs and perform a few rounds of head rolling to help dissipate any tension in the neck and shoulder region. Danda Kriya. Danda Kriya is a systematic and rational movement that energizes the entire spinal column. It also helps us to unite our breath with our body movement and thus corrects numerous psychosomatic ailments. Sit in Vajrasana and take in a deep breath. Breathe out and slowly lower your head to the ground in the Dharmikasana. On the next incoming breath, slowly raise your buttocks up into the Purna Shashasana. Lower your buttocks while breathing out and come into the Dharmikasana. Slowly come back to the Vajrasana while breathing in and then breathe out while sitting in the Vajrasana. On the next incoming breath, slowly come up onto your knees and bend your back to perform Sapurna Ushtrasana, the incomplete camel posture, with your hands dangling loose at the side of your body. Keep your eyes open to avoid feeling dizzy and slowly come back to the Vajrasana while breathing out. This completes 1 round of the Danda Kriya. Repeat this Kriya a minimum of 3 to 6 rounds at each session for maximum benefit. The Danda Kriya is an excellent practice to develop spinal health and relax the mind. It is important that you make sure that you are breathing while you are moving, as the most important aspect of this practice is to unify your body movements and your breath cycle. This helps to restore the vital mind-body connection and produces sound health and well-being. After completing 3 to 6 rounds of the practice, slowly relax in Vajrasana with deep and relaxed breathing. Vakrasana. Sit erect with your legs stretched out in the Uttanasana. Bend your right knee and place the right foot by the side of the left knee. Turn to your right and place your right hand on the ground behind you to support your erect position. Bring your left arm round the outer side of the right knee and catch hold of the right big toe. Turn your head and look back over your right shoulder. The erect knee acts as a fulcrum for getting maximum twist of the spine. Keep your torso as straight as possible. Hold the posture for 10 to 30 seconds with soft breathing. Release the posture and come back to the Uttanasana. Repeat the practice on the opposite side. This posture gives an excellent massage to the abdominal organs and is very useful for those suffering from diabetes as well as digestive disorders. It is also useful for back and neck problems. Ardha Matsyendrasana. Sit erect with both legs stretched out in front and your palms gently pressing on the ground by your side. Fold your right knee and place the heel tight in against the perineum. Place your left foot by the side of your right thigh by crossing it over the knee. Bring your right hand over the outer side of the left knee, passing between the chest and the knee, and catch hold of the left big toe. Take your left hand around your back and try to get a grip on your right thigh. Look back over your left shoulder. The erect knee acts as a fulcrum for getting maximum twist of the spine. Keep your trunk vertical and hold the posture for 10 to 30 seconds with soft breathing. Release and come back to the Uttanasana. Repeat on the opposite side. This posture gives an excellent massage to the abdominal organs and is very useful for those suffering from diabetes as well as digestive disorders. When you are ready, slowly release the posture and come back to the Uttanasana. Ekapada Uttanpadasana. From Shavasana, lift your right leg up towards the sky on the in-breath. Try not to bend the knee if possible. On the out-breath, lower the leg back to the ground. Use a breath cycle of in and out for a count of 6 or 8. Repeat this 2 more times. Perform the same practice on the left side. Lift your left leg up towards the sky on the in-breath. Try not to bend the knee if possible. On the out-breath, lower the leg back to the ground. Use a breath cycle of in and out for a count of 6 or 8. Repeat this 2 more times. After performing the practice at least 3 times on each side, relax in Shavasana with deep breathing. Those who have back problems should not do straight leg lifting and should do it with bent knee instead to avoid increasing the strain on the back. Dvipada Uttanpadasana. From Shavasana, lift both legs up towards the sky on the in-breath. Try not to bend the knees if possible. On the out breath, lower the legs back to the ground. Use a breath cycle of in and out for a count of 6 or 8. Repeat this 2 more times. And then relax in Shavasana with deep breathing. Those who have back problems should not do straight leg lifting and should do it with bent knees instead to avoid increasing the strain on the back. Sirasa Uttana Asana. From Shavasana, lift your head on the in-breath. Lower your head on the out-breath. Use a breath cycle of in and out for a count of 6 or 8. Repeat this 2 more times and then relax in Shavasana with deep breathing. Pavanamuktasana. Lie down in a comfortable Shavasana and start to breathe in and out for an equal count of 6 or 8. To perform the single leg Ekapada Pavanamuktasana, bend and lift your right knee while breathing in and simultaneously also lift your head off the ground. Catch hold of your knee and try to touch your knee to your forehead. Hold the position for a few seconds and then while breathing out, slowly release the position and lower your head while at the same time bringing your foot back to the ground. Perform the practice on the opposite side by bringing the left knee to the forehead. Hold the position for a few seconds and then slowly release the position and lower your head while at the same time bringing your foot back to the ground. Repeat this at least 2 more times to complete a set of 3 rounds of the practice. This practice helps relieve the stress and tension that tends to accumulate in the abdominal region. It is also useful to prevent and control the various joint disorders that afflict the limbs and the abdominal organs. Relax in Shavasana for a few minutes with deep and rhythmic breathing while concentrating on your abdominal area that will help to relax you further. To perform the double leg Dvipada Pavanamuktasana, bend and lift both your knees while breathing in. Bring them as close to your forehead as possible while simultaneously raising your head to meet the knees. Hold a few seconds and then while breathing out, lower your head and simultaneously bring your feet back to the ground. Repeat this 2 more times to complete a set of 3 rounds at each session. The Pavanamuktasanas help to prevent and relieve joint pains, gas troubles, and abdominal problems such as indigestion and constipation. They are also useful for persons suffering from diabetes mellitus as well as liver disorders. When ready, relax in Shavasana for a few minutes with deep and rhythmic breathing while concentrating on your abdominal area. Jatara Parivrasana. On the respective sides to make a cross-like figure. Breathe in and lift your right leg up towards the sky as in the Ekapada Uttanpadasana. Breathe out and slowly lower your right leg over your body until the right foot is on the left hand. Breathe in and turn your head to the right. Breathe out and bring your head back to the center. Breathe in and lift your right leg back to the original position. Breathe out and lower the leg back down to the ground. Relax for a few seconds. Repeat the practice 2 more times. To perform the opposite side, breathe in and lift your left leg up towards the sky. Breathe out and slowly lower your left leg over your body until the left foot is on the right hand. Breathe in and turn your head to the left. Breathe out and bring your head back to the center. Breathe in and lift your left leg back to the original position. Breathe out and lower the leg back down to the ground. Repeat the practice 2 more times. Please note that those who have back problems should not do straight leg lifting and should do it with bent knee instead to avoid increasing the strain on the back. Once you have completed the practice on both sides, bring your hands back to the sides and relax in Shavasana for some time. Sarvangasana. Lie down in Shavasana, breathe in and lift both legs at a time until you are in the Dvipada Uttanasana. Continue the upward motion and lift your back off the ground using both arms to support the lower back. Keep your trunk and legs in a straight line by supporting the entire trunk on the shoulders. Breathe in a shallow manner while concentrating on the healthy pressure at the throat region. Release the posture after 10 to 15 seconds and while breathing out, slowly come back to the Shavasana. Roll your head from side to side to ease away any pressure that may have accumulated in the neck. After short relaxation, repeat the practice 2 more times. Sarvangasana stimulates the endocrine system and is especially good for the thyroid gland. The thyroid gland is in charge of body metabolism, and increased metabolic activity burns up the excess calories effectively. Those suffering from neck problems and infections of the head and neck region must avoid Sarvangasana. Janusirasa Sarvangasana. Lie down in Shavasana. On the in-breath, raise both legs together and come into the Sarvangasana. Keep the trunk and legs in a straight line by supporting the trunk on the shoulders. Breathe in a shallow manner while concentrating on the pressure at the throat. To perform the Ekajanu Sarvangasana, breathe out and bend the right leg. Try to touch your forehead with your right knee. Keep the sole of the right foot against the front of the opposite thigh. Breathe in and out for a few rounds and feel the healthy pressure over the right upper abdominal liver area. When ready, release the position and bring the leg back up into the Sarvangasana while breathing in. Do the same on the left side by bending the left leg to bring the knee to the forehead. Breathe in and out a few times and feel the pressure over the spleen area of the left upper abdomen. Release the position and bring the leg back up into the Sarvangasana while breathing in. To perform the Dvijanu Sarvangasana, the double knee to head action, breathe out and bend both legs until both knees are touching the forehead with the feet pointing upwards. Breathe in and out a few times and feel the healthy pressure over the entire abdominal area. All organs of the abdominal cavity are given an excellent massage with a tremendous improvement in circulation, thus helping your digestive system to function at its best. When ready, release the position and come back to the Sarvangasana while breathing in. Those who have neck problems shouldn't do this posture as it may aggravate the neck pain. Relax into the Shavasana and enjoy a period of well-deserved relaxation. Perform a few rounds of deep breathing and roll your head from side to side to ease away any pressure that may have accumulated in the neck. Viparita Karani. From the supine Shavasana, slowly lift both your legs up as if performing the Sarvangasana. However, the weight of your body should be balanced on your elbows and arms and not on your shoulders. Viparita Karani is the shoulder stand-like mudra where the weight of the body is supported by the elbows while the hands are placed against the pelvic girdle. Hold the posture in a comfortable manner and then start to perform the incomplete and complete actions of this mudra. Perform the incomplete action by taking a deep inhalation and bringing your straightened legs towards your head so that your body makes an acute angle. Then perform the completed action by pushing your legs away while exhaling the breath. Make sure that your feet are extended in a rigid position, making an obtuse angle. Breathe in, bringing your feet towards your head. 1, 2, 3, 4, 5, 6. Breathe out, pushing your feet away. 1, 2, 3, 4, 5, 6. Continue the practice for a minimum of 3 to 9 rounds of this alternation between the incomplete and complete postures with the breath cycle at every session. This mudra promotes a healthy metabolic function by stimulating the pancreas and the uptake of insulin by cells of the body. It is highly recommended for the prevention, control, and possible cure of conditions such as diabetes mellitus and imbalances of the thyroid gland. It is also useful to reduce prolapsed organs such as the uterus or rectum back into their normal location. When ready, slowly bring your legs down to the ground in a phased manner and enjoy a quiet period of relaxation in the Shavasana. Halasana. From Shavasana, lift both legs up towards the sky on the in-breath. Take the legs over the head until the toes touch the ground beyond the head. Do not bend the knees. Stretch the arms out behind the back or hold on the lower back with the elbows on the ground. Breathe in a shallow manner while concentrating on the healthy pressure at the throat region. Those who have neck problems shouldn't do this posture as it may aggravate the neck pain. Release the posture after 10 to 15 seconds, and while breathing out, slowly come back to the Shavasana. Roll your head from side to side to ease away any pressure that may have accumulated in the neck. Matsyasana. Sit straight with your legs stretched out in front. Fold up your legs and perform the Padmasana. Bend your elbows and relax backwards until your elbows are flat on the ground. Use your hands to lift the shoulders off the ground in an exaggerated back bend until your entire weight is balanced on the top of your head. If possible, catch hold of your toes with your fingers and bring both your elbows down to the ground. Perform 3 to 9 rounds of deep breathing in this position. When ready, return back to the Padmasana in a careful step-by-step manner. Unlock your feet and stretch them forward into the Uttanasana, and then slowly return to the supine Shavasana. A couple of rounds of head rolling from side to side in Shavasana can help release any pent-up tension in the neck that may occur after performing the fish posture. Navasana. Lie down in Shavasana with your arms by your sides. While breathing in, slowly come up to the Uttanasana. Hold in the breath and raise both feet off the ground until the toes are in line with the nose. This is the Navasana, the boat posture. The hands are placed alongside the legs for maximum benefit. On an outgoing breath, slowly lower the feet to the ground and recline back, allowing each vertebra of the spine to return to the ground as though the treads of a caterpillar tractor. After short relaxation, repeat the practice 2 more times. The abdominal and thigh muscles are toned up in a healthy manner by the regular practice of Navasana. A massive supply of blood is also sent down into the pelvic area by the healthy tension of holding this posture. Lie down in Shavasana and relax for some time with deep breathing. Paschimottanasana. Sit in Uttanasana, breathe in and raise your arms over your head. Clasp the fingers together and turn them up to perform Dandasana. Slowly bend forward with emphasis on your lower back until you can catch your big toes with your index finger and thumb. Stretch up and then bend further forward until your face rests on your knees. Hold the posture for 10 to 30 seconds with gentle breathing. When ready, release the fingers and stretch back up into the Dandasana. Come back to the Uttanasana. Lie down in Shavasana and relax for some time with deep breathing. This posture helps to stretch the entire back and tones up the abdominal organs. Digestion is improved and body metabolism speeded up. Abdominal fat is also burnt away. Patients of hypertension and back troubles should avoid Paschimottanasana. Bhujangasana. Lie down in the face-prone Unmukhasana with your hands by your sides. Bend both your elbows and place the palms on the ground by the side of your chest. Slowly lift your head and then raise your chest until your arms are as straight as possible. Feel the awareness of the bending at the lumbar region. After a few seconds, relax and bring your chest and head down, touching the ground with your chin. Release your hands and then relax in the Unmukhasana. Repeat the practice at least 2 more times for maximum benefit to the muscles of the lower back and posterior region. This practice helps tone up the muscles of the entire posterior region and redistribute any fat from the hip and lower back region. Dhanurasana. From Unmukhasana, fold both your knees and catch hold of the feet with the respective hands. Raise your head and chest and also the thighs by tugging on the hands and legs so that your entire spine is arched backwards like a bow. Look up and feel the stretch in the entire back. Hold for a few seconds and then relax back in the face-prone posture. Dhanurasana massages all the abdominal organs and restores proper function to the digestive system. Repeat the Dhanurasana at least 2 more times for the maximum benefit. Do not do this posture if you suffer from any diseases of the liver or kidneys, as the intense pressure may be too much for the weak organs. KRIYA Pranayama. Sit in Vajrasana with the weight of your body firmly on both heels. Place your palms on the ground in front with your wrists touching your knees and the fingers pointing forward. Open your mouth wide and push your tongue out as far as possible. Breathe in and out at a rapid rate with your tongue hanging out of your mouth. After 10 to 15 rounds, relax back into Vajrasana and feel the blood flow into your abdominal area. Repeat the whole practice 3 more times. KRIYA Pranayama, the dog pant breath, is an excellent cleanser and tones up the diaphragm and the abdominal organs that are in close proximity to the diaphragm. After 10 to 15 rounds, relax back into Vajrasana and feel the blood flow into your abdominal area. Kavi Pranayama. Sit in a comfortable and straight-backed Vajrasana. Clench your teeth so that the upper and lower rows are as tight together as possible. Slowly start to inhale through the gaps between the teeth until your lungs are completely inflated. Perceive the cooling effect of the air as it passes over the tongue. Relax the lips and close the mouth. Allow the breath to be stopped effortlessly. Slowly start to exhale, letting the air pass through both your nostrils. Allow the breath to be held comfortably for some time. When ready, repeat the cycle again by clenching the teeth and breathing in. Hold the breath and relax the lips with the mouth closed. Exhale when ready through both nostrils. Hold the breath for a short while. Repeat the cycle at least 9 times at each sitting for maximum effect. This pranayama is one of the cooling pranayamas and involves inhaling the breath through the clenched teeth thus giving it another name, Sadanta Pranayama. Chandra Nadi Pranayama. Sit in Vajrasana and perform Nasika Mudra with your right hand. Close your right nostril with your thumb. Inhale slowly through your left nostril for a count of 4. Now exhale through the same left nostril for a count of 8. Keep your right nostril closed throughout the duration of the practice. Repeat the Chandra Nadi Pranayama for a minimum of 9 rounds at each session. Patients of anxiety, hypertension, diabetes, insomnia, and other stressful conditions can benefit by practicing this pranayama 27 times before breakfast, lunch, dinner, and before going to bed at night. Pranava Pranayama. This pranayama uses the primordial sound of the Omkara and has unlimited healing potential. It harmonizes the body, emotions, and mind and is an important part of the Rishi culture Ashtanga Yoga tradition as taught by Yoga Maharshi Dr. Swami Geethananda Giri. In this practice, emphasis is first placed on making the sounds A, U, and separately and then in combination. This is followed by the performance of the practice mentally without the audible sound. Sit in Vajrasana and place the Chin Mudra on your thighs. Breathe in deeply into your lower chest area. 2, 3, 4, 5, 6. Breathe out with the sound A. Breathe in 2, 3, 4, 5, 6. Breathe out. Breathe in 2, 3, 4, 5, 6. Breathe out. Now concentrate on the sound A mentally and perform the same practice 3 times without the audible sound. Curl your fingers inward to form the Chinmaya Mudra and place it on your thighs. Breathe deeply into your mid-chest region. 2, 3, 4, 5, 6. Breathe out with the sound OO. Breathe in 2, 3, 4, 5, 6. Breathe out. Breathe in 2, 3, 4, 5, 6. Now concentrate on the sound OO mentally and perform the same practice 3 times without the audible sound. Perform the Adi Mudra by clenching your fists with your thumb in the center and place the mudra on your thighs. Breathe deeply in your upper chest and clavicular regions. 2, 3, 4, 5, 6. Now exhale with the sound Breathe in. 2, 3, 4, 5, 6. Breathe in. 2, 3, 4, 5, 6. Breathe out. Now concentrate on the sound mentally and perform the same practice 3 times without the audible sound. To perform the 4th part of the practice that unites the 3 earlier parts, perform the Adi Mudra and then place it with the knuckles of both hands touching in front of the navel. This is known as the Brahma Mudra. Take a deep breath into the lower, mid and upper chest regions. Now let the breath out with the sounds A, U, Breathe in. 2, 3, 4, 5, 6. Breathe in. 2, 3, 4, 5, 6. Breathe out. Now concentrate on the sound and perform the same practice 3 times without the audible sound. A performance of 3 to 9 rounds of the Pranava Pranayama, when done daily, helps to relax the body, emotion and mind complex and provides complete healing through the production of healing vibrations at all levels of our existence. This is the cornerstone of yogic breath therapy and can produce health and well-being for all. When the concentrative aspect of the practice is taken to its peak, a state of meditation or pranava dhyana can ensue. Shavasana. Lie supine on the ground with your head preferably to the north, enabling your body to be in alignment with the Earth's electromagnetic field. Make sure that your head and body are in a straight line, while your hands are kept relaxed by your side with the palms facing upwards. Bring your feet together and then let your 4 feet fall away into a V shape with your heels as close together as possible. Start to consciously watch your breath by letting your awareness settle in the abdominal area. Feel the abdominal movements as your abdomen rises as you breathe in and falls as you breathe out. After a few rounds of this practice, slowly let your awareness settle at the tip of your nose. Feel the cool, inspired air flowing into your nostrils as you breathe in and become aware of the warm, expired air flowing out of the nostrils when you breathe out. Consciously regulate your breath so that the duration of the incoming and outgoing breaths is equal. The inspiration and expiration can be for a count of 4 or 6 initially, and then with practice, elongated to a count of 8 or 10. Perform at least 9 rounds of this conscious deep breathing and enjoy the relaxed sensation that spreads throughout your body. The relaxation in Shavasana can be further deepened by utilizing the Savitri Pranayama to relax and rejuvenate your body, emotions, and mind. Breathe in through your nose for a count of 6. Hold in the breath for a count of 3. Breathe out through your nose for a count of 6. Finally, hold the breath out for a count of 3. Make sure that you are breathing in and out through both nostrils and that you are using the complete yogic breathing. Perform at least 9 rounds of this combination practice that heightens the relaxation to a very deep level. Shavasana is a relaxing and energizing posture in which the body, emotions, and mind are united in the process of conscious relaxation. 15 minutes of Shavasana, properly performed, is equal to more than 1 hour of refreshing sleep. Om Japa. Take up any meditative posture and start to perform the Savitri Pranayama in a 6x3 or 8x4 rhythm. Breathe in 2, 3, 4, 5, 6. Hold 2, 3. Breathe out 2, 3, 4, 5, 6. Hold 2, 3. Breathe in 2, 3, 4, 5, 6. Hold 2, 3. Breathe out 2, 3, 4, 5, 6. Hold 2, 3. Breathe in 2, 3, 4, 5, 6. Hold 2, 3. Breathe out 2, 3, 4, 5, 6. Hold 2, 3. Make an audible pranava Om in the Bindu Nadi. With Japa Ajapa, make silent intonation of the pranava Om, concentrating at the same point. Do not let the mind waver away from either a conscious repetition of the mantra Om as Japa or as the silent Ajapa.
Namaskar. Welcome to this series of videos where we shall take a look at various applications of yoga as a therapy. Yoga is the ancient art and science that has sprouted from the fertile soil of the Indian culture. Yoga is popular today more as a therapy. More people come to yoga to improve their physical conditions, to improve their mental conditions, to improve their emotional conditions. Yoga as a therapy is much more recent in the wonderful long history of yoga. Yoga is primarily an art and science of spiritual evolution. Yoga helps us unify all aspects of our very being. The physical body in which we live our daily life, the energy body without which we will not have the energy to do what we do, the mind body that sends the mind impulse, helping us to do the tasks with mindfulness, the higher mind, and finally the universal body. The physical, the energy, the mind, the higher mind, and finally the universal body. All of these bodies are unified by the very practice of yoga. Yoga helps bring about a union between the body, the emotions, and the mind. It can be said to be the science of right useness, using the body, using the emotions, using the mind in the right manner. One of the best definitions of yoga is that yoga is a way of life. It is not something you do for 5 minutes a day or 20 minutes a day. It is a 24-hour lifestyle. Yoga helps us to live better. Yoga helps us to think better. Yoga helps us to become better at whatever we are. The ultimate goal of yoga is spiritual evolution. Yet, in the modern world today, one of the major reasons people take up yoga is as a therapy. Illness, disease, and so many disorders are so common in this world that people want a remedy. They want relief from their suffering. According to the Bhagavad Gita, the ancient text which can be said to be the Yoga Shastra, Lord Krishna defines yoga as Dukkha Samyoga Viyogam Yoga Sangitam, meaning thereby that yoga is the disassociation from the union with pain. Pain, suffering, disease. Yoga offers a way out of all of this. One of the foremost concepts of yoga therapy is that the mind, which is called the Adi, influences the body, creating Vyadi or disease. This is known as the Adi Vyadi or Adija Vyadi, where the mind brings about the production of disease in the physical body. Nowadays, this is called psychosomatic illness. Virtually every problem that we face in our health today has either its origin in psychosomatics or is worsened by the psychosomatic aspect of the disease. The mind and the body seem to be fighting each other all the time. What the mind wants, the body doesn't do. What the body wants, the mind doesn't do. This creates a dichotomy, a disharmony, a dis-ease. Yoga, unifying the mind and the body along with the emotions, helps restore the balance, restoring equilibrium. These psychosomatic disorders that are so prevalent in today's world, they can be prevented, controlled, possibly cured with the sincere application of yoga as a therapy. Psychosomatic disorders go through 4 major phases. The first is the psychic phase, where it's all the stress in the mind. There's a jitteriness, there's a tension, a sense of not being at ease. If this continues, the psychic stage becomes a psychosomatic stage. Now at this stage, the mind and the body, they are troubling each other, and the body starts to have these temporary fluctuations, such as your blood pressure goes up, or your blood sugar goes up, or your heart rate goes up. And then if this is allowed to continue, it becomes a somatic stage where it is settling in your body, and then you are having that condition permanently. It is a condition which requires treatment and therapy. The fourth of the stages is when all of this psychic, psychosomatic and somatic conditions have now settled into the organs, creating the organic stage of the disease, which could be termed virtually the end stage of the disease. Yoga therapy works excellently at the psychic and the psychosomatic stages. Once the disease comes into the somatic stage, yoga therapy along with other therapies can definitely help improve the condition. When it comes to the organic stage, yoga therapy's role may be more of palliative, pain relief and rehabilitative nature. The major role of yoga is as a preventive therapy, preventing that which is to come. Maharishi Patanjali in the Yoga Sutras tells us, Heyam Dukkham Anagatam. Let us prevent those miseries that have yet to come. If yoga is taken up in the childhood itself, we can prevent so many conditions from occurring later on in life. This is primary prevention. Once a condition occurs, once the disease has set in, we have secondary prevention, which is more of the nature of controlling the condition to whatever extent we can. And then tertiary prevention, where once the condition has occurred, we try to prevent the complications, those complications that can affect the quality of life and even the quantity of life in our patients. I would like to conclude this introduction with a word of caution. Yoga therapy is not a magic therapy. It is not a one pill for all ills. There should be no false claims, tall claims made in this field, because yoga therapy is also a science. It has to be approached in a scientific step-by-step manner. It should be a one-on-one therapy where the therapist can modify the practices as per the individual requirements. It is not one size fits all or one therapy fits all. We need to take into consideration the age, the gender, the physical condition, as well as the condition of the disorder when we are applying yoga as a therapy. A step-by-step approach involving aspects of diet, involving aspects of our lifestyle, involving aspects of the way we think, involving yogic counseling. Well, all of these are part and parcel of yoga therapy. When such a yoga therapy is applied, I am sure that you will find tremendous changes in your life. The quality of life improves drastically, and in many cases, even the quantity of life improves. I wish you a wonderful time, a time where you can help evolve from that animal nature to the human, to the humane, and ultimately the divine nature through this wonderful art and science of yoga that now you are being introduced to as a therapy. I wish you a happy, a healthy, and a fruitful sadhana in yoga. Namaskar.